So after our procedure, because we leave an implant in, we talked about fusing our spine together, we take x-rays to see how things actually turned out. What we see here, here's a side picture of our neck, so our head is here. See 1, 2, 3, 4, 5. That fused 6 and 7, and then we're into our ribs with the big, tall spinous process. So what we did, we drill through the bone here, pull out the disc that was compressing from below, but also from here, and pull out the disc that was compressing from below. To minimize the motion that's there, we put a plate underneath and screws into the bone to keep things nice and stable. I wish I could have bent our plate a little bit and actually angled a little bit more, but to get an angle on T1, to get these screws to go in more appropriately, we would have had to go through our chest and opened up our lungs, and the complication rate would have been a lot higher. So we decided not to do there and just get longer screws that get purchased into the underside of the bone. So I'm very happy with how that turned out. And then our top-down picture. Here is heads up at the top. Here's our heart in the middle. And here's our plate. We've got in C6, 7, and then back down into T1 with that first rib. So everything is nice and aligned. There's not going to be any instability at that spot anymore. So hopefully, even over time, the articular facets, the joints that are growing inwards from the sides, because they're not moving anymore, they may regress and actually may increase the space within the vertebral canal to give more room for the spinal cord. I think she's going to do great.